Let's talk about dog bites. This is part 2. If you haven't seen the first video on this, that's where I talk about bite scales, the importance of bite scales, the limitations of bite scales, and right now we're about to dive right back in. I'm explaining the various levels of dog bites. All right, so in the last video, we talked about level 1 bites, which are actually not bites, they're snaps. Snaps are intentional warnings. We are grateful for snaps. Snaps are intentional misses. Level 2, we discussed, are greatly inhibited bites. This is where the dog is, again, showing a lot of inhibition. We may have superficial breakage of the skin, but nothing more than 1/10 of a centimeter. There may be some bruising. These are most bites, level 1 and 2. Level 3 bites do have punctures. 3A is a single bite. 3B is multiple bites, indicating higher levels of arousal. Dogs have sensors halfway up their canine teeth that say, okay, that's enough biting. When a dog listens to that sensor in their body, we call it an inhibited bite. Level 3 bites are still inhibited bites. Level 4 bites are no longer inhibited. They typically come after many practices of a level 3 bite. But again, bite scales do not account for context. So I could have a dog who, let's say, was just hit by a car, is in incredible pain, very scared, someone runs out to help them, and they bite at a level 4, but this dog has no other bite history or any history of aggression. That might be a very different case than a dog who has bitten at a level 3 several times and is now biting at a level 4. Level 4 bites are uninhibited. They are deeper than half the length of the canine tooth. Level 4 bites also include any bites where the dog shakes their head. A level 5 is simply multiple level 4 bites, and the only difference between a level 5 bite and a level 6 is that the victim dies. Now, when we are looking at these injuries, it's important that we're looking at the injuries as they existed before medical treatment. A lot of times dog bites can look a lot worse after medical treatment because they have to be kind of pulled open to be cleaned. Similarly, we do not make bite level assessments based on the medical treatment. So we're not going to say, oh yeah, it was so bad it needed stitches, and that tells us some kind of bite, because what an individual doctor may choose to do, what someone's insurance allows them to do, the region in which someone lives can all affect these decisions. And so the doctor's decision after the fact, or what someone's insurance allows, does not dictate the assessment of the bite. So remember, bite scales are not the end-all be-all. They lack context, but they can be very important information for us. Everyone's level of risk threshold is different. My job is to help people make informed decisions.